Again, thank you for joining us for the webinar, Toxic Chemicals and Reproductive Health, What Clinicians Need to Know. Today we're very lucky to have the following speakers present. We have Alexandra Scranton. She's the Director of Science and Research at Women's Voices for the Earth. Alex authors weaves scientific reports and provides scientific review for the organization's programs. Katie Hupfling is a certified nurse midwife and is the Director of Programs for the Alliance of Nurses for Healthy Environments. With the Alliance, she directs projects related to environmental health nursing practice, research, education, and policy and advocacy. Elizabeth Shank has over 25 years of nursing experience. She lives and works in Missoula, Montana, addressing environmental impacts of healthcare. She's also an assistant research professor in nursing at Washington State University, studying the environmental impacts of nursing practice. So again, I want to thank all of our speakers for taking time out of their schedule to participate in this webinar. And to start us off, Alexandra Scranton at Women's Voices for the Earth is going to go first.
All right. Thank you so much, Jamie. And welcome, everybody, and good morning. My topic today is the impact of toxic chemicals on reproductive health. And I'm sure I can't do justice to this topic in about 15 minutes, but my goal is to highlight and examples and really make a case for why this issue is important and how it's relevant to you and your patients. So for those of you who may not be fully familiar with the work of Women's Voices for the Earth, our mission is to amplify women's voices to eliminate the toxic chemicals that harm our health and communities. And while there are a number of groups around the country who work on eliminating toxic chemicals, we've chosen to focus specifically on the disproportionate exposures and impacts that women experience. So we look pretty closely at exposures from things like cleaning products and cosmetics on women, which they use more than men do. And much of what we do naturally relates to reproductive health. This is a main area which is pretty gender-specific biologically. And it's an area of women's health that so often gets overlooked and is understudied with respect to toxic chemicals particularly. So we try to do our work to bring greater attention to this area. We help educate and increase the general knowledge base on toxic chemicals and reproductive health, while also advocating for changes so that women can have fewer toxic exposures and be healthier overall. So what are some of the impacts of toxic chemicals on reproductive health? Well, very briefly, I've got a slide that talks about some of the trends in health and disease that really have us concerned. There are these rising rates of certain diseases and conditions in women that are largely unexplained. For example, breast cancer rates have risen from 1 in 20 to 1 in 8 over the last 2 decades, just tremendous growth in breast cancer rates. The onset of puberty in young girls is now occurring at an earlier age than 40 years ago, and that has also some potential lifelong health implications. Endometriosis is an example. It's a leading cause of infertility in this country. It's much more commonly diagnosed today than it was 50 years ago. So these are some of the things that have us concerned. And so what this might have to do with, chemicals in our environment. Well, it turns out that chemical exposure has also been changing dramatically in recent years, like in the last 40 years. One statistic I have is sort of growth in chemical production in the past 40 years has just been explosive. In 1970, it was about a $171 billion market of chemical production. In 2010, that had grown to $4 trillion. So it's an increase of about 2,000% of chemical production, and it's projected to increase. So this is, better living through chemistry, right? These chemicals are used in the products we use, they're used in manufacturing, and they're getting into our environment, they're in our household products, and these chemicals are getting into our bodies at unprecedented levels, and they're chemicals in our bodies that were completely foreign to our grandmothers and great-grandmothers, right? And so the question is, are we getting sick from these chemicals? And this is, of course, very hard to prove in many cases, but there is a lot of new science coming out that is generating concern about the exposures that we're seeing. And I got on my slide a couple of examples of some of the new research that has us concerned. Phthalates are an example of chemical very predominantly found in people all the time. These are plasticizer chemicals, particularly found in vinyl plastics, among other things. And exposure to these chemicals has been found to disrupt hormone levels, particularly testosterone production seems to be altered with exposure to phthalates. It's been very clearly seen in animal studies to cause feminization of males when there's in utero exposure. Other reproductive issues like hypospadias have been linked to phthalates. And there is some limited data in humans as well on kind of subtle feminization effects in baby boys as well. So it's definitely chemicals that are generating concern. Bisphenol A, or BPA, is another one that's been in the news quite a bit. This is a chemical found in plastics. It's found in canned food liners. It's in thermal receipts like grocery store receipts. In utero exposure to high levels of BPA has been linked to abnormal breast cell development, which can then predispose these women to higher risk of breast cancer down the line. There's also some new data on BPA exposure being linked to increased risk of miscarriage, and we don't know exactly how that is happening, what that mechanism is, but there's certainly concern there for reproductive health and this exposure. And these are, again, chemicals found in just about everybody you test for them. Lead is just another example. This is an old contaminant. It's found basically everywhere from use in products, and it's still used as a stabilizer in PVC plastic. Lead exposure in utero is linked to neurological impairment. It's linked to lower IQs in babies. And there is also some data linking lead levels in women to menstrual hormone changes, which could be affecting fertility when your levels of hormones are altered from what they should be. So these are just a few examples. I was also going to talk about triclosan, but Beth, our later speaker, is going to delve into that and do a great job of that. So she'll tell you a little bit about that later. Another great example of a chemical of concern linked to health. So the science here is very complex. Some of these endpoints that we're looking at are pretty subtle. Some of this impacts can be intergenerational. Sometimes it depends on what your grandmother was exposed to as to how it's going to affect your health. And there's still, of course, a lot that we don't know. But the best advice that we feel we can give at this point is from a precautionary standpoint, is to really avoid those exposures to problematic chemicals that you can control. There are a lot of exposures we can't control, but some of them we can, and where we can act, we feel we should. So as health practitioners, you guys are very important voices and very important messengers of this advice to take precautionary measures to avoid exposure. Okay, so when can you talk to patients about toxic chemical exposure? There are key windows of vulnerability in a person's life when avoiding exposure may have more impact and may have more sort of salience to them. And these windows can translate into good opportunities to talk to patients about these issues. So pregnancy is kind of the obvious window of vulnerability. There's so much key development that happens that can sort of go astray when there are toxic chemical exposures in utero. And this is, of course, a time when women really start to pay attention to these issues. They pay attention to their own exposures when it's not just their own health on the line, it's the health of their future children. But what often gets neglected is the time period before pregnancy, at the very end, at the very beginning of pregnancy, that is also really important. For one, there are toxic chemical exposures that build up over time. So you really have to be careful about your exposures before you get pregnant so you don't have high levels when pregnancy begins. The other thing is that there's tremendous impact in those first few weeks of pregnancy when there's so much development going on, when often you don't even know that you're pregnant yet. And you've kind of missed it, if you just start paying attention once you have a positive pregnancy test. So that's what we call it. So the preconception period being really an important time to focus on. And for many women, when is this important exposure, time to think about? It's really effectively always, until you know for sure that you won't be having any children, because as we know, so many pregnancies aren't planned. So there's so many women who aren't aware that they're pregnant or that they're planning to get pregnant, and so we need to be thinking about the effects that chemicals are having on our bodies kind of all the time during our reproductive years. So another key time when women can be reminded of these issues is really every single month, sort of associating these concepts with menstrual cycles. And this is the focus of our latest campaign, which we call Detox the Box, which looks at toxic chemicals in feminine care. And what I mean by feminine care is menstrual products like pads and tampons, cups or sponges, as well as a whole host of products that are marketed to women like feminine sprays and washes, their creams, powders, douches, lubricants, etc. Now, the key factors about all of these products is that they're obviously exclusively products for women, and they all have direct vulvar and vaginal application. Now, the skin of the vulva and vagina, of course, is not like the skin on the rest of our body. They include mucous membranes, there's a close exchange with blood vessels, these are very permeable tissues and absorptive tissues, there's specialized bacteria that colonize this area, the kind of microbiomes of the area are very specialized. And unfortunately, not all feminine care products have been formulated with these special factors in mind. What we've found in our research is that many feminine care products contain a lot of the same types of chemicals that are found in other cosmetics just for your skin, but there's almost no research as to whether or not the chemicals that are used in these products are appropriate for this area of the body. A huge issue that we've noted is the common use of known irritant chemicals, including lots of different preservatives, there are disinfectants. A lot of these products are heavily fragranced and full of allergens, and these can lead to irritation of the vulvar and vaginal skin. So many of the feminine care products, particularly kind of the washes and feminine washes and sprays and lotions, these are products being purchased by women in an effort to either prevent or self-treat irritation or itching conditions in this area of the body. And the problem is so many of these products are likely making the problem worse, given the harsh chemicals that they include. So we found this is a really great way to discuss these concerns about toxic chemicals with women, because it really resonates when you think about what kind of chemicals you're actually putting in and on such a sensitive part of your body. Okay, so how can you communicate these ideas to your patients? Well, there are now going to be 3 fact sheets that will be available to you that have been developed with Women's Voices for the Earth and Planned Parenthood, and I'll just briefly mention them and what they are. The first one that you can see is called Top 10 Tips to Reduce Exposure, and this has 10 easy general tips to avoid exposure, things like avoiding fragrance, making your own cleaners, even something as simple as removing your shoes at the door when you get home, which can reduce levels of toxic chemicals in your home. So not very difficult things to do, but things that really can have an impact, simple changes. The second is our tips to avoid chemicals before, during, and after pregnancy. Now, a lot of the tips on this page are very similar to the first top 10 tips, but the fact sheet is kind of framed around pregnancy, breastfeeding, and the preconception period as well for women who are kind of more primed and thinking along those lines. And then the third is our chemicals of concern in feminine care products fact sheet, and this lists a number of ingredients that we've found in feminine care products, ingredients to avoid that people can look on the ingredients list of their products. It lists the name of the chemical, the kind of product it's commonly found in, and why we find it problematic. So these are 3 resources that you can use to sort of get these issues out to your patients. We hope you'll find them useful and that they'll lead to interesting and fruitful discussions with your patients. So the next slide is just my contact information. I'm always available for further questions, and I think we'll do Q&A at the end of our speaker. So thank you very much.
Thank you, Alex. That was a great overview of some of the links between toxic chemicals and reproductive health. Next, we have Katie Huffling, who's going to be talking about sustainability in healthcare. And just as a reminder for folks who join the call, if you do have a question, you can type it into the chat box, and we'll get to it at the end. Katie, do you want to?
Great. Can you hear me?
Yes.
Excellent. Hi, good morning, everyone. So glad I'm able to join you here today. So I'm going to be going over how as clinicians, as healthcare providers, we can be leaders in change in healthcare, and how we can start greening our healthcare offices, and how it impacts both the health of the clinicians and staff, but also the health of our patients. And I'm going to provide a few examples of different things that you can do in the office to start greening your office based on some of the chemicals that Alex went over in her talk. So just to give you a little context of why it's important to be greening the office, but also how it impacts our bottom line, because as we know in healthcare, it's tough financially out there. We have to always be looking at that. And so, sometimes as you talk about sustainability, people think it's, very expensive, or, it's not going to be something that you're able to do, in these tough times in healthcare. But I think if you look at it in a different paradigm, what we call the triple bottom line, it becomes apparent that there's ways that you can assess these changes that you're doing, but also making it financially feasible. And so this new way of looking at this is the triple Ps or triple Es: profit, people, planet, and obviously assessing your profit. You're looking at how much money you're making and your cash flow. But then there's ways that you can also assess. So for people, if you're doing these greening activities in your office, how is it impacting staff turnover, days absent from work, employee satisfaction? There's been a lot of research that shows when you start to do these activities in the office that you get better outcomes with those variables. Looking at the planet, things like how much waste your office is generating, water usage, the chemicals that you're using in your office, and how that's impacting the health of your staff and clientele. So there's a number of different ways to look at this topic, and that I think can be used to help push, more and more greening activities in the office setting. So why would you be wanting to do these greening activities? Over the past 20 years, I think hospitals in the U.S. have made a lot of great strides in their sustainability efforts, but we haven't seen as much focus on healthcare offices. And when you see that there's millions of healthcare offices worldwide, if all of these offices started to make even just small changes, the collective impact would be truly amazing. Healthcare offices are full of chemicals and products that can negatively impact health. Because we use so many different products in the office, from cleaning chemicals, just general office products, the air quality in offices can actually be worse than the air outside. And as an example, several years ago, researchers looked at the risk of asthma for a number of different professions, and nurses actually have the highest risk for asthma of any of the professions that they looked at over some pretty, heavy-duty industrial professions, which was quite surprising. And cleaning staff weren't that far behind with the risk of asthma, and it's thought to be caused by the chemical exposures that occur in healthcare. Healthcare offices also use significantly more resources than comparable business offices. They use up to 3 times more energy, significant amount of paper, cleaning products, the medical equipment. So we have some really great opportunities there to reduce the use of these valuable resources. We also have an opportunity to be role models. If we're talking to our clients about things that they can be doing to reduce their exposures in the home, it's nice if we can be role models in the office as well and showing them that it's possible to do these things. And then again, it's also a great place for education and helping them make those changes. We've got kind of a captive audience when they're sitting in the waiting room or waiting for the clinician to come in. Having those information sheets like Alex was talking about is a really great opportunity to help with change. So about 5 years ago, Planned Parenthood started their Green Choices project, and before they did this project, as they were looking at how they were going to be pulling it together, they held a number of focus groups. And the first focus group that they did was with some clinicians in one of the New York offices. And what was really interesting is when they were talking to them about environmental health and what they were planning to do, the clinicians were like, whoa, this information is really scary. And it feels like it'd be really hard for our clientele to be able to make some of these changes, or we're just going to freak them out. Like they felt like it would be really hard to do this type of environmental health work with Planned Parenthood's clientele. And so they went back, looked at what they were working on, and then they decided to do a couple of focus groups with both urban clients and then also with suburban clients. And they had the exact opposite reaction. The clientele were like, this information is so great. I'm so glad that you're talking to us about this. How can you give us more information? So I think, as you're looking to do these activities in your offices, I think you're going to get a really great positive response. I had looked on the Planned Parenthood site main page to see if the Green Choices assessment tool and fact sheets were still up on the website, and they weren't, but they are on my organization's website. I have the link there if any of you wanted to look at them. The assessment tool has, I think, 7 different sections, and then the environmental health information sheets. Each one goes along with those different sections to hand out to your clients. And so getting started, I think if you're going to be tackling these projects in the office, it's good to start small. Starting with one focus area, I think it's easy to get excited about doing some of these different things, but if you try to take on too much at one time, it can be a recipe for disaster. Forming a green team, if you have clinicians and staff that are interested in doing these greening activities in the office, starting a green team is a great way to keep momentum going and to build excitement around it and to get staff buy-in. I was just at a conference last week, and I found out about this great resource. I can't believe I didn't know about it. It's called mygreendoctor.org, which I actually spoke with the physician that created this resource, and I was like, this might be better with a different name that's a little more inclusive. So I think he's going to be looking at maybe rebranding it. But he developed it based on his experiences greening his office. And it has tons of tools on ways that you can green your office. So I highly recommend, if that's something that you're interested in doing, going to that website. Practice Green Health is also a great resource. They have an eco checklist for offices, but unfortunately their eco checklist, I believe, is only available if you're a Practice Green Health member. But offices can become members of that, and they have lots of great resources on sustainability and greening healthcare. And I'm just going to provide a few examples of ways that you can green your offices, specific examples, and why it's so important. So I thought I'd start with healthcare waste. Healthcare produces an amazing amount of waste. Every year you can see 5.9 million tons per year. And it's really important that we look at how we're sorting that waste. Medical waste in the red bags costs 5 to 10 times more than regular solid waste. And so making sure that we're sorting our waste properly is really important and can save a lot of money for our offices. I was actually at that same conference. They had a director of a federally qualified health center from Philadelphia. They just built a new office there. It's in one of the poorest neighborhoods in Philadelphia. And when they built their new office, they really looked at how they were disposing of waste, and they felt like it was really important to have composting and to put the food waste in its own separate containers. And they've had really great buy-in from the staff and from the community, and it's actually made the community members start thinking about that, something that they could do as well. Cleaning products, I think, is another great way to reduce exposures. Cleaning products, the ingredients in them have been linked to things like fertility issues, breast cancer, birth defects. There can be some really nasty ingredients in cleaning products. So taking a look at what type of cleaning products you're using is a great way to reduce exposures for both staff and for clientele. Especially a lot of these cleaning products, if they have strong scents in them, if they have an added fragrance, many of them are asthmagens. And so reducing exposures to those can have really positive health impacts. One of the major issues that we have is that the manufacturers don't have to disclose ingredients in their cleaning products, so it can be a real challenge to figure out what's actually in products. Another thing to look at too is what level of cleanliness is needed. Do you need to have your front office desk disinfected to the same level as an operating room? No, you don't. You need to look at working with the staff to figure out what level of cleanliness is needed, so you don't need to be using all of these toxic chemicals. And there's several great resources out there. These are third-party certifications that you can see on products when you're buying them. They're not perfect, but I think it's a good place to start. When the green seal is great, it's for more commercially available products, but what's great about them is most of the cleaning products that they certify come in concentrated forms, and so you get a gallon of the cleaning product, and it maybe costs $35, but then you're able to make 120 gallons from that. So it's a great way for the office to save money while reducing chemical exposures. Fragrances are another issue. How many of us have gone into healthcare offices and you go in the bathroom and there's spritzers, like sometimes you can't even stop it from going off. These spritzers and deodorizers, they're not made up of crushed up flowers. They're made of things like phthalates and musks. These have a variety of health impacts besides being asthmagens. Some of them are linked to hormonal issues and reproductive health effects. And so, reducing these exposures in our clients and talking to them about why we don't want to be using these fragrances, I think is an easy way, low-cost way to reduce exposures. Phthalates, as Alex was saying, are plasticizers, and they're used quite frequently in healthcare. You find them in IV tubing, IV bags, and when the fluids are running through them, then our patients are being exposed. And so making an effort to switch to phthalate-free IV tubing and IV bags is, again, another great way to reduce exposures in our patients. And because there's been such an interest in the healthcare community for these phthalate-free products, now the costs are very similar. They used to be significantly more expensive than the phthalate containing products, but now the prices have gone down. So again, it's a great way to reduce those exposures in our patients. Flame retardants are chemicals that are added to upholstered furniture to reduce the flammability, and unfortunately they don't work very well, and they also don't stay in the products. From the time that you buy an upholstered furniture that has flame retardants in it, those flame retardants are coming out of your upholstered furniture. They're getting into the dust, into your living area, and Americans have the highest levels of flame retardants in their bodies of anyone in the world. And if you are in your office or you go home and look at your upholstered furniture, probably most of your furniture is going to have on the bottom side a tag like what you see here that's saying that it complies with the flammability requirements from California Technical Bulletin 117. This flammability requirement was enacted in the 1970s, and because California is such a big market, all the manufacturers sell the same types of products throughout the U.S. that they use to comply with the California markets. Flame retardants have been shown to impact how long it takes for a woman to get pregnant. They may have smaller babies if they have higher levels of flame retardants. Kids exposed in utero have lower IQs and attention problems. So these are a significant problem within our with our upholstered furniture. So luckily, California just changed their regulations, and now we have a new technical bulletin 117/2013, and that these manufacturers aren't going to be required to be adding in those flame retardants. So if you're looking to add new furniture in your offices, this is something that you should ask the manufacturers. Are you adding flame retardants into your furniture, and spec out finding non-flame retardant furniture for your office. And then finally, integrated pest management. Depending on what you do at your office, you may have pesticide applicators coming in once a month and applying pesticides regularly, even if there aren't pests being shown. And those pesticides, they get in the air. You can be touching them, walking on them, tracking them home. And so, these are toxic chemicals that were created to kill something. And so they're not without risks to human health. And so, again, another great way to both reduce costs but also exposure is to implement an integrated pest management plan. And it's like a common sense plan. It keeps the bugs out, get rid of the sources of food and water, and then if you do need to use pesticides, if you do get a pest problem, then you're able to use them. And if you're looking at having a contract with a pesticide applicator, having it in the contract that they need to use integrated pest management is key, so that you can reduce exposures for both staff and your clientele. And then finally, here's a few resources. I've also got another slide with some resources, which I'll flip to. But these all have great information for everything from assessment tools. They have product recommendations, as well as trainings on why these different things are so important, what the health impacts are of various chemical exposures, and how healthcare can make these changes. I haven't read this book, but this just came out, Greening Healthcare, How Hospitals Can Heal the Planet, by Kathy Gerwig. She's the Director of Sustainability with Kaiser Healthcare, and they've been change leaders, and she has lots of great recommendations in that. And so I'd highly recommend that if that's something that you're interested in doing with your healthcare organization. So thank you so much. I'll pass this over to Beth, and I forgot to add a contact information slide for myself. But you can reach me at katie@envirn.org. Thank you.
And I can send that email out to everybody, Katie.
Okay. Thanks.
Thank you, Katie. That was a great overview of the importance of sustainability in healthcare for not only practitioners but patients too. So we appreciate it. And now we're Beth is going to walk us through a specific step that has been taken in the hospital to a case study of reducing triclosan. Beth, you want to take it away?
Yes, good morning. Can you hear me?
Yes.
Okay, terrific. Well, welcome everyone. Glad you could join us this morning. Working to reduce our chemical exposures is something that all of us on the call are committed to and are happy to have your ear for a moment. As Alex mentioned, triclosan is another chemical of concern, and I'm just going to walk you through a case study of how we were able to eliminate it in our hand soaps. It is still present in other items, which I'll tell you a little bit about, in a hospital. This is a 250-bed hospital in Montana. So first of all, some of this has already been discussed a little bit. We know that triclosan causes harm. And we know this primarily through studies in the wild, the existing species in waterways, including amphibians and algae. We also know it because it's been studied in the lab with animals, and that has led to hormone destruction. It's been evident that it is linked to hormone destruction in a variety of ways. So for instance, in amphibians, it's a blurring of the genders a little bit, and in algae it just prevents their own reproduction. It's not so much gender issues for the algae. And then in lab mice, it also has led to distorted genitalia and reproductive issues. So that's much harder to know about what's happening in humans, as Alex and Katie both referenced that when we have a complex situation of many exposures over many different times in our life, we don't exactly know how they interact. We don't exactly know when we're most vulnerable. We have kind of a mess in terms of science to try and understand it. And yet we defer to, whenever possible, the precautionary principle, which states that if there's something that is a risk, even if we don't fully understand its mechanisms or its potential harm, then we should choose safer options when we have them. So that's what is behind this decision at this hospital to reduce this harm by eliminating triclosan. It's in the majority of U.S. waterways, so that's surface water and even some groundwater. It's in the majority of human beings. About 76% of Americans that were tested through urine sample did have triclosan in their urine. Also, besides these harms that we fear might happen with our reproductive issues, it can cause antimicrobial resistance. So that's a growing problem around the world, especially as we face some of these growing infectious diseases. And as mentioned, there are some better alternatives. This image at the bottom of the slide is from the Skin Deep database that Environmental Working Group provides. If you're not familiar with that, that's a fantastic tool. You can just go look it up online, plug in the product or chemical of concern, and it'll give you a rating scale 1 through 10. 7 through 10 is the more harmful end. They're red, and the middle range is yellow, and the lower range is green. So triclosan comes out as a red. It's a 7. That gives us some evidence for it. Okay. So what we wanted to do, and I had been working on getting rid of triclosan for a while at our hospital, and where triclosan is found, the one that we were working on was in our hand soaps. So you know that people in healthcare wash their hands a lot every time in and out of a room, after the bathroom, anytime they're visibly soiled. And so there's a lot of exposure in a career to whatever is in the soap or the product. So we wanted to eliminate the triclosan in our soaps because I had known that other hospitals had done this and we could too. So we started, myself and a physician I worked with, started talking with our infection control physician and nurse, and they didn't disagree that there might be a risk, but their primary concern was preventing infection. And granted, that's super important, and the last thing we want to do is spread disease or worsen someone's health while in the hospital. But we all know that hospital-acquired infection happens. It's a complicated issue. And the infection control people in the nation and beyond are using all sorts of tools to try and fight this, and that's very important. In fact, as an aside, sometimes I work as an environmental sustainability coordinator, and sometimes people will come to me and say, can't we just cut down on the gloves and gowns we use for our isolation patients? And it's true that preventing infection is very resource intensive. We use chemicals, we use plastic, we use a lot more time, we use more equipment. And yet I tend to think that on the balance it's still an environmentally responsible thing to do, because if an infection happens, not only is it, just a terrible outcome for the patient and their family, it's unethical, but also we use a tremendous amount of resources fighting an infection once it's taken hold. And I would argue that potentially more. So that's an aside. And now back to triclosan. So what we did, my physician friend and I, is provided a summary of the data. So all the data that we could do, I had actually written a paper on it in my education and had fairly recent studies, ranking through what we know in the wild, what we know in controlled lab studies, and what we know in humans. And while we can't completely identify what is everyone's individual risk, we know that there's a group risk, and we know that the more exposure, there's more risk. So after some time and looking at the available products and looking at how hard it would be to trade all the equipment out, we did agree to move to a two-soap system. And what we're doing is we changed to a different antimicrobial, and this is not a perfect solution. It's a better solution, I believe, but it's not perfect. Chloroxylenol, and we only have that in patient rooms, nurses' stations, and high-touch areas. So there was some resistance earlier to going to two soaps because it means you have to keep track of where the soaps go, train environmental services staff differently, have labels differently, and it's, operationally more complex. But that was a big step because that meant it was kept out of all public places, all office spaces, all bathrooms. And so that alone reduces exposure quite a bit. And then also nursing staff and others are taught that they use alcohol hand sanitizers coming in and out of rooms unless visibly soiled. And so more and more they are washing their hands with soap and water a little bit less. So those were the ways that we impacted this. And you see the Skin Deep database scorecard for this chemical. It's lower, it's 3, it's yellow, it's not green. I'd like to also get rid of that, so that's some of our next work. Luckily, we stayed with the same manufacturer, and doing any of these changes requires all the pragmatic side of, well, how much is it going to cost? How do you have to change out containers? What do you have to do to repair the wall and paint after you change containers? So we were very glad that we didn't have to change containers at all. We could just change the soap that's inside a replaceable bag and change the label. So that was very helpful. We did do a trial and watched for skin sensitivity or other issues that people reported, and we really didn't get any. And so those proceeded after a 2-week trial on several units. And this all happened in 2012, so we were very keen to watch what happened as results. And things that we watch in an ongoing way are our infection rates. We did not receive any comments at all about skin sensitivity or allergies, and that often happens, when a product changes or a smell changes or the feel of something changes. When you have hundreds of people or even thousands in some places using it, you usually get some comments. And also we had no increase in infection. This was of key importance. And in fact, we did have a decrease in our C. diff infections, but we know that we were also going through a tower refresh with doing deep cleaning in our facility. So we're not claiming that that's because of this, but at least it's good to know that we had no worse and even better. And also by decreasing the amount of antimicrobial soap purchased, we actually saved money. This was an unexpected win, but that matters. So now this is spreading throughout our system of 35 hospitals in the Northwest, and it's considered to be a cost savings method that also infection control supports widely. So that's terrific. And I've had a number of opportunities, such as this one, to discuss how other places might do this. And also it's a win for us in our community because we let people know we've gotten rid of this chemical. You're not exposed to it if you come to our hospital. Our staff is not exposed to it. Our community is not exposed to it, nor is our aquifer. So that's a win for all. Now, since then, a couple of interesting things have happened. And first, I'm going to look at the second bullet point. You may have heard that Minnesota banned triclosan. So they are taking it out of their products. They're not going to allow it in their products. However, one of their compromises with industry was that they gave them a few years. So it doesn't go into effect until January 1st, 2017. But I'm hoping that that's a bellwether. That's the beginning of just getting rid of this chemical. It's not necessary. And then the first bullet, this was new just last month in August of 2014. And this is the first because I have scoured the literature extensively on triclosan, and this is the first time that a professional organization in infection control has come out and said, just don't use it. Triclosan should be avoided in healthcare settings. It's been known for some time that it should be avoided in home settings, but the healthcare settings was a little bit sticky. And so that is great news, and I hope that will spread. And I hope, that it would be terrific if Planned Parenthood, I don't know if Planned Parenthood uses triclosan. It would be great if they could make just a national decision not to and just take it out of their purchasing lineup. And then I just have resources, that some of which are repeats of Katie. Just a second. There we are. But some of these are infection specific. Some excellent papers there, and I assume that you're getting these slides. I'm not quite sure, but we won't dwell on all the website. And then I do have my contact information as well, so I'd be happy to hear from you. Thank you.
Great, thanks, Beth. And next we have Rachel Pauley. She's a grassroots organizer for Planned Parenthood, and she's just going to talk for a few minutes about some of the resources that are going to be available in Planned Parenthood clinics starting probably at the end of October. Rachel, are you on?
I am. Can you hear me?
Great, yeah, and I put up the slide of the fact sheets.
Oh, excellent. Yeah, so thanks to everybody for being on the call today, especially to our presenters. Planned Parenthood is really pleased to be working with Women's Voices for the Earth. So we hope that a lot of this information helps facilitate some conversations at Planned Parenthood on greening our lives and being pioneers in the health care facilities, as well as role models to our patients. So the fact sheets are up on the screen, and so as you can see, they're co-branded, and they're going to be for providers' use. And as Jamie was saying, they'll be ready at the end of October, and we'll get those out to the health center communities. We're just waiting on some approval from Jill and the team to print these materials. And they're, like I said, going to be out in October, and we'll get those to you. Another thing we're going to be doing in October is the organizers in each community. So Jules, Jen, Jessica, and myself will be working with the health center staff to implement a pill pack campaign in which we'll be distributing wallet cards with tips to avoid exposure in feminine care products. So we're really looking forward to getting those out to our patients. Those also will be coming out in October. And that's basically all I have, unless anybody has any questions. But I want to also thank Jamie for running the call today. And again, thank you to the presenters for waking up early and presenting to the folks here at Planned Parenthood of Montana.
Great. Thanks, Rachel. And if you have any questions about these resources that we'll be providing to clinics, feel free to get in touch with either Rachel or Women's Voices for the Earth. And unfortunately, I don't have a picture of the feminine care wallet card, but Alex went over a little bit kind of the importance of talking to patients about reducing their exposure from feminine care products, and the wallet card is just a great resource that patients can use to do that. So now we have about 10 minutes for questions. I can open it up, and I'm just going to, you can either type your question in the chat box, or I can unmute everyone, which I'll be doing. So if you want to speak up, feel free.
The conference has been unmuted.
There we go. Did anyone have any questions? Well, maybe I can ask a question. Beth, I was wondering if there's any, in your summary of data, if there's any data on washing, clinicians washing their hands with a soap that has triclosan in it, and can that exposure, like the triclosan that's residue that's on your hands, can that be passed on to patients?
There's really been no studies like that I have found. And Alex and Katie, if you know otherwise, let us know. Because it just hasn't been studied amongst nursing or amongst clinical staff in that way. And I can't tell you if it would be or not. In theory, clinical staff, when they touch patients, usually have on gloves. So, I would think that exposure would be quite low. That exposure risk would be quite low. Alex or Katie, what do you think?
Yeah, no, I agree. I mean, triclosan is kind of a persistent chemical, so there's certainly the possibility for residue on your hands, so the gloves would decrease that for sure.
Yeah, I agree.
And Beth, that summary of data that you compiled for your staff at the hospital you work at, is that something that you would be able to share if folks were interested, or?
Yes, I would. I have to say that I have not updated it since 2012. So these other events are on top of that, including the Minnesota decision and this report that's come out from Shea. So it would be great if it could be updated, and if I have time to do that, I could consider that. But yeah, if people need that, sure, I would share it.
Great. Any other questions to ask our experts?
Well, hi, this is Erin at Women's Voices for the Earth, and I have a question for any of the clinicians on the line. I'm just curious to know if if you all are getting any questions from patients around this, and if you, if this is something that you think is on people's radars already, or if this is a real opportunity for education.
Well, this is Beth. I can speak just briefly in terms of some of the patient comments we've received, and we received actually comments about triclosan some years ago, and so that helps. It helps me. I always quote when patients have a concern about, or family or staff have a concern about a chemical, because awareness of chemicals is not high enough. I think it's just assumed. I mean, I've even had people who are purchasers at the hospital say, well, if it's for sale, it must be safe. You think, well, no, that's not the case. We know that, and there's a lot of reasons for that. I've had comments about styrene, so the styrofoam that is sometimes used, because we know that styrene migration happens, especially in hot and fat-filled foods. And what is styrofoam for except for hot foods? And there's often cream in your coffee or cheese on your burrito or whatever. So we've had comments about that. Had comments about cleaning, the smells of cleaning products. So definitely people are aware, but I think not nearly enough. That's what I would say.
Mm-hmm. Anybody else want to add to that? Katie, I think that stat that you talked about was interesting, that when patients were surveyed, that the information didn't feel overwhelming to them, that it was something that they were really interested in receiving.
Right, and I was actually involved in another project that was similar. There was a group that was creating a video to be shown in waiting rooms at OBGYN offices. And it was a company that does lots of health education materials, and they had the same response when they did focus groups. It didn't matter what education level or socioeconomic level the women that participated in the focus groups, they just wanted more information. They were really interested in it, and they weren't put off by it. They weren't scared by the information. I think it's a really great opportunity for you to take control. I mean, so many things that impact our health, we don't have any control over them, but this is something that we can have some control. I mean, it's not perfect, but there are things that we can do.
Yeah, definitely.
This is Erin again, and I'm not exactly sure what kind of question this is, but one of the things that really struck me is that I'm currently pregnant, and the last time, when I went for my first OB appointment, I got the bag of stuff that they give you at your OB appointments. And one of the information pieces in there was an advertisement from Lysol, and it was really a booklet promoting, the need to kind of disinfect and keep your new baby healthy. And I was sort of appalled because I know what's in those products, and it was really a prime opportunity for that company to promote their information. And I'm just wondering if all of you working in healthcare have a sense of sort of how that information is accepted into the system, because it seems to me that we could have many more important resources like the ones that we've developed here that could be included in those bags to women versus the sort of advertisement piece. So I'm just curious if you all know, and maybe this happens on a case-by-case basis per hospital and per clinic, but if there's any sort of kind of review or acceptance process for what education pieces women are receiving.
I think it depends on the office, what they, in the healthcare institution. I mean, when I was working full-time as a midwife, all the midwives in our group would decide on what would give out in these different packets. And it's definitely a concern. It's the same thing that you see with formula companies and giving out formula to women after they've given birth. What kind of message is that saying? Or, giving them, even for a breastfeeding pack, having advertisements for the formula companies. So I think it's something that the healthcare institutions need to be aware of and have some type of process for deciding what goes into those packets.
Mm-hmm. Yeah, I would just add that with in hospitals, which are a little bit different than a clinic, I think it's a complicated situation, and I know that it has been cracked down more recently on, particularly for pharmaceuticals. So there's so much influence from the corporate world in the clinical world, and so up until maybe 5 or 8 years ago, it was still common to have sales reps in the clinical spaces. They could do whatever they wanted basically because they brought lunch, and so that has really changed a lot in the past, maybe it's 10 years. But it's a different question to say, well, how do the products that people use actually get decided upon? So, for instance, there might be some companies that make educational materials, and you'd have to read each piece, which at some level someone does. But I think it depends on the organization, and I think it's kind of a slippery slope. I think our organization, which is very large, 35 hospitals, has they're fairly sensitive to any messaging basically that comes from an outside group. So, but I would have to say that oftentimes if someone has something that they want to just give away, a lot of places will say, sure, that's free. People will like that. Right. So I think there has to be an intentional decision to evaluate what's going in and out, and that doesn't always happen.
Right. Mm-hmm. Yeah, it seems really, really tough.
Mm-hmm. Well, we're at 9:30, so if there are not any more questions, I want to thank our speakers, Beth and Katie and Alex, and we, as I said earlier, we have recorded this webinar, and we'll be sending out a link to the recording that you can share with colleagues. So thank you all for attending.
Thanks, Jamie.
Thank you.
Thank you. Have a great day.
Thank you.
Bye.